I want to tell you about a patient that I'll remember for the rest of my career, probably the rest of my life. As doctors, we treat thousands of patients, and unless my memory is much worse than that of my colleagues, sadly, we simply cannot remember them all. But some stay with us. Maybe they touched our hearts in some way, maybe something went wrong. Maybe they taught us a bit about ourselves and helped us grow as a person and as a doctor. It's that last category that this case fits into for me, and it's actually a case I feel a deep guilt and regret about. Now, I don't really talk about cases very often on this channel, as I don't like the idea of using patients that I've seen as content, and I'm often alarmed at the lack of respect for patient confidentiality that medics online can display, with some talking about cases they've seen the very same day, and it would be very easy for a patient to identify themselves, which is a breach of our professional guidelines. But of course, there are ways to do it. After all, some of the most celebrated memoirs from heroes of mine like Oliver Sacks, Henry Marsh, Atul Gawande, and so on focus on patients' stories. So my golden rules are, for any other medical creators watching, if I do want to talk about a case, number one, the reason itself should be good, never at the patient's expense. So to my colleagues, please think twice before posting that x-ray of something stuck up somebody's bum. And number two, ask consent if you can. If you can't, then allow sufficient time to pass and change the details sufficiently so they cannot be identified. So hopefully I'm on safe ground here, because more than 15 years have passed since I met this patient. It was actually in my second year as a doctor. I have you, the viewers, to thank for making me do this, because the other reason I've not talked about cases is because I think other people do it much better than I would, not least my friend Chubby Emu, who I mentioned in a recent video, and a commenter pointed out that actually I present cases in a different style, and I realized, yes, I am special. I bring something to the table that other social media medics simply cannot offer, and that is advanced years. Yes, I stand in direct contrast to the young, good-looking, bubbly and earnest and financially conflicted internet doctors. But once upon a time, I too was young, I was young, and that's when I met a patient that I will call Jerry. Now, Jerry was a quiet, stoic man who was clearly the patriarch of his family. He was about 70 years old, and he had a huge family that very obviously loved him, not least his wife, but also his four formidable daughters. I was working in the emergency department at the start of my second year as a doctor. Now, in the UK, we rotate around different specialties in our first 2 years. It's not like the US where you match directly into your chosen field. You have this sort of 2-year rotation. And let me set the scene so you know what I was like. I think if you've watched me before, it'll come as no surprise that I was, what's the technical term? A cocky little shit. I had that competitive, driven personality. I pride myself on knowing all the answers to bosses' questions, to knowing all the patients' results, reading all the latest research. And I was aiming for some high-flying academic career. I'd even earned myself the semi-mocking, or more than semi-mocking, nickname of Prof from my peers. And I'd ranked top in job applications, and I'd landed a very popular rotation. But this brought with it a fairly unfeeling, detached, and clinical personality that was transfixed by the physiology, the numbers, the science, and it ignored all the messy humanity and emotions. That was for other specialties where people hold hands and talk about feelings. I was planning on cardiac surgery, and I very much fit that stereotype, which didn't mean I didn't enjoy chatting to patients. I've always found people interesting and like talking to them, and I feel one of the great privileges of this job, in contrast to, say, working in an office, which I did for a year, is that I get to meet people from every walk of life. So that's something I've always liked, but I was not the empathetic, touchy-feely kind of doctor, and I'm still not, if I'm honest. It just doesn't come that naturally to me. And you have to maintain a bit of emotional distance in this job or you will go mad. So now I've set the scene for my character arc. Let's get to the main character of the story, who is Jerry. And he was admitted into hospital in kidney failure, which is a new diagnosis. He had something called nephrotic syndrome, which is not rare, but it was the first time I had seen it. This is where the kidneys lose their ability to hold on to protein, and you lose protein in your urine, which can cause all manner of problems because, of course, proteins are the building blocks of pretty much everything in the body, and they have lots of functions, but protein in your blood also affects the oncotic pressure, meaning nephrotic patients balloon up with swelling as water leaks out of their blood into the tissues. And Jerry had become severely edematous, swollen, right from his legs all the way up to his abdomen. He was probably carrying over 20 kilograms of excess water. But in spite of that, he still looked quite regal sitting in bed. I met his wife, I met his 4 daughters, and referred him onto the kidney team. And at that point, everybody was in fairly good spirits. The family were grateful to me that I'd found a problem that could be treated. And I thought, well, my job here is done. Unfortunately, Jerry would never leave hospital. As it would happen, my next rotation was kidney medicine. And I met Jerry and his family again. And now he'd been in hospital 2 months and he'd already lost so much flesh weight. The water weight had come off, yes, but also just muscle and his body mass. He still maintained that serene, taciturn demeanor, but he was markedly different from when I first met him, as were his daughters, who maintained an almost around-the-clock presence and made their anger at any number of issues known. We spent many hours talking to them, explaining things, apologizing for things that were out of our control, but they felt that what we were doing was not sufficient. Now, of course, they were simply scared and worried for their dad, and that is obvious, but as a 24, 25-year-old, I found it difficult to reason with them. Jerry was very unwell. He seemed to develop one problem after another. His potassium would shoot up, his sodium would go down, his diabetic control would swing wildly. He developed multiple infections, and at some point, he started on dialysis. Now, dialysis is very common and it's low risk in many stable patients, but in someone who's unwell, it can be quite a physical challenge. So in short, he was very unlucky. He really needed a kidney transplant, but he never got anywhere near being well enough to survive that. And while each crisis was dealt with, nothing we seemed to do reversed the slow overall decline. And anybody who's watched a loved one ravaged by disease over a few months will understand the pain of seeing someone full of life slip away. To be honest, some of the medical aspects of the case have faded over time, but this case is more about the emotional impact. If you'd asked 25-year-old Rohin the emotional impact then, he might have said dealing with Jerry's family had become his least favorite part of his workload. Now, while I was the most junior member of the team, I was also the one who was kind of around the most, so I received the brunt of the family's complaints, and of course, so did the nurses. The daughters covered everything from his bed, his light, his TV, his food, the temperature. Why haven't we tried this? Why haven't we tried that? What was this result? Why aren't we doing another scan? Why do we have to wait till tomorrow? And I'm ashamed to say I started trying to avoid his family because the conversations didn't seem to achieve anything. I know what they were really asking was, why haven't you made our dad better? But as I didn't have an answer to this in the moment, I just wanted to dodge these time-consuming conversations, which prevented me from doing my other jobs for the other 35 patients on the ward. Now, I'm not saying his daughter's demands were always reasonable, but the end result was that the relationship between Jerry's medical team and his family had become fractious and unsatisfactory for both parties. As I neared the end of my kidney rotation, Jerry deteriorated further, and now he had started bleeding internally, and this was a real mystery. And with him already in such a precarious position, it meant that he was admitted to intensive care, and you guessed it, this was my next rotation. Sadly, this bleed, I think, would mark the beginning of the end for Jerry. My rotation in IT it's one of the 3 ITUs in that hospital, one of the biggest hospitals in Europe at the time, with access to the very best medical care in the world. Many of the other cases that I'll remember my whole life are from these months that I spent there. It was a pivotal moment in my career, and it's fair to say I loved my time on intensive care. It appealed to my love of the hard science of medicine, the complex and critical illness, impassionate decision-making with patients often being asleep. And in contrast to the kidney medicine, where the mind-boggling immunology and vascular disease would often fly over my head, I was back in my element, and I think you could say I took to it like a duck to water. After multiple blood transfusions and trying to figure out why Jerry was bleeding, we were none the wiser. He continued to have these wild fluctuations in other blood tests, having several treatments that I'd never seen before. Most curiously, his lactate kept shooting up. Now, lactate is a non-specific marker in the blood, but regarded by all healthcare professionals as bad news. It goes up in severe infection, in shock, where the body doesn't receive enough blood, and in something also called ischemic bowel, where the blood flow to the bowel is interrupted and the bowel tissue, the intestines, begin to die. Now, we didn't think it was the first two, so in conjunction with the fact that he was bleeding internally, we called the colorectal surgeons, the surgeons who look after the bowel, who took him to theatre. And this is when things got very strange. Now, as a side note, which is completely unrelated to the rest of the video, and will probably completely ruin the tone, but I thought you might find it amusing, so I wanted to share. The surgeon who came to see Jerry was an absolutely lovely person who had been my supervisor the year before. We'd coincidentally just moved to the same hospital this year. And she had asked me to film her wedding the year before, which is something that I used to do. This was the last one I did, and for reasons that will become apparent. And on this occasion, I arrived late. She was literally walking up the aisle as I arrived. I guess this is some kind of confessional video or something, because I'm pretty sure this is the other biggest regret in my life. I'm not exaggerating. The guilt still eats me up. And to her credit, she didn't even seem to mind. Now, her military husband made his views apparent to me, and I seriously considered going into hiding. But after giving her the DVD of the incomplete wedding ceremony afterwards, and almost needing admission to the intensive care unit myself with a life-threatening case of cringe, I basically avoided her after that, and hadn't spoken to her for over a year when she walked into the intensive care unit, and I was shocked. But then again, showing what a lovely person she is, she just greeted me with a "Hi, Rohan" in her characteristic bubbly way. So I will confess, I have looked her up in the years subsequent online to see if she got divorced. Now, it's not unreasonable. Surgeons get divorced all the time, and it would be terribly sad for her and her husband if that marriage didn't work out. But it would really take a weight off my shoulders, because if their marriage didn't work out, then no one's watching the wedding video, are they? So, isn't that really the main thing that matters? Is my guilt? Funnily enough, people don't put that information on LinkedIn, so I'm none the wiser. Look, I think the point is I've grown as a person, okay? So please don't get angry with me for stuff I did almost 20 years ago. But back to the story. Very nice surgeon explained that in the operating theatre, Jerry's bowel went a dusky, worrying, grey kind of colour, but then pinked up spontaneously on its own. So they didn't remove anything, but we were left none the wiser about what was going on. And things seemed to be stable for a little while. But then again, Jerry's lactate started shooting up and his hemoglobin went down again. And at some point, the surgeons had no choice but to take him back to theatre. And this time they did end up removing some bowel. But again, they talked about this colour change and they didn't know which bowel was healthy, and they didn't want to remove a healthy bowel. So they did something that I've never seen before and never seen since. They left a bag of saline in the surgical wound. They covered it all with a transparent dressing and then brought him back to intensive care. Now, it's not unheard of that surgeons might leave a wound open if there's overwhelming infection or inflammation. But I'd never seen this bag of saline idea. And the surgeon explained it to me that with this ongoing mystery of the high lactate and intermittently dusky bowel, they wanted to know if any of the residual bowel underwent the same color change. So the saline would allow us to look straight through into his intestines. And very nice surgeon described it to me in a way that I will never forget. She said it was a window on his soul. In the end, it didn't help. Jerry just became more and more unwell. He'd been intubated now for several weeks. His daughters continued to make a lot of demands of us, but with the intensive care team being much bigger, I hadn't felt like I was the only one in the firing line. And actually, as ITU has much stricter visiting rules, I'd got to know his wife better when it was just her by his bedside. And it was clear that the whole family were finally beginning to accept how serious Jerry's condition was after perhaps being in denial for a long time. One day I came onto my shift and the nurse in charge said, "Rohin, can you go and see Jerry's family? They're asking for you." And I'll be honest, my heart sank. What a way to start a 12-hour shift, getting shouted at yet again. And I went to his cubicle and I was immediately shocked that about 15 family members were there, all holding hands in a big circle. And Jerry was still somehow this oasis of calm in the middle of everything. He was still intubated, of course, but the only sounds were that of sobbing and ITU machines making bongs and beeps. And I stood there motionless, not sure how to process what was going on, as it was not what I expected when I walked in. But before I knew what was happening, Jerry's wife and daughters had pulled me in for a huge hug. And it's hard to explain what emotions washed over me at that time, but I think the main one was guilt. This was only exacerbated by, once I was released and then implored to join the prayer circle by Jerry's wife saying, "You've been there for Jerry through this whole admission. I'm so glad you're there at the end." The ITU consultant had explained to Jerry's family overnight that he was going to die. His wife asked me to stay, say a prayer with them, sing some hymns, and I won't say exactly where they were from, but Jerry's family were from a tropical island nation with a very proud church-going tradition and devotion through song. So it was quite a sort of colourful and emotional farewell. Now, meanwhile, I'm a non-Christian atheist, and my beliefs are completely irrelevant here. I only mention that to say that it further made me feel like an imposter. Instead of appreciating this deeply emotional moment and being thankful that the family wanted one person from the entire team that had treated their loved one to be part of this farewell, I was instead racked with guilt that I had thought all these thoughts about wanting to avoid this family, and I felt like a complete fraud. I didn't deserve this special treatment. I spent some time with Jerry's family, and my friends kindly covered my shift for a short while, and then I left them as his heart beat its last and his life as a much-loved father and husband came to an end. How had I got this so wrong? How had I misread this family's attitude towards me? I guess I got away with it on this occasion, but it was their generosity at such a difficult moment that shocked me into reassessing my attitude. Just weeks later, I would visit my uncle, about whom I've actually talked before on the channel in my video about placebo effect, when I was talking about the feel-good effect one can get from a caring doctor. But this time he was a patient. He was in hospital in Manchester. And I spoke to the team, and coincidentally, I noticed his lactate was going up. Now, I don't want to say the senior doctor ignored what I said. Remember, I was a very junior doctor at the time, and maybe there was a bit of dismissiveness, but they seemed a bit disinterested. Now, I imagine they were just tired and overworked, and they meant nothing by it at all, but later that day, my uncle would die, and I would remember that interaction with the doctor. Now, to be clear, I don't think the outcome would have been any different, but it made me realize that any conversation I have with a patient or their family might be the last one. When I left ITU, I knew that what first appealed to me about the field, the cold, hard numbers and the perception of patients as a series of test results and physiological measurements like Morpheus looking at the matrix code, is now what put me off. I was glad I got to know Jerry when he was awake. In contrast to most of the other intubated patients on the unit, I had a mental picture of who he was. And I don't want to misrepresent intensive care medicine here. I have tremendous respect for them. While they might not talk to patients as much as other specialties, they probably spend more time talking to families and having very difficult conversations than any other specialty. So I would actually end up accruing about 18 months experience in ITU through my career, and I maintain a keen interest in it. But after Jerry, I realized that I preferred interacting with awake patients so that I know who they are and what's important to them. When a resident doctor presents a case to me, I can forgive them forgetting to check the x-ray or what year they had an operation, but I will send them back and tell them to do it again. If they cannot tell me what the patient does for a living or how much they can do for themselves, are they running marathons, do they need help getting out of a chair, I need to know something about them as a person, not just a list of their medical problems and their blood results. In spite of the myriad challenges of this job, in spite of the spectacularly deteriorating working conditions in the NHS, in spite of going to work feeling like it's more and more like a masochism fetish. The biggest privilege of this job is getting to be part of people's lives, even for a brief moment, and leaving a lasting impact. I hope I've made a good impression with most patients and families I've met. I'm sure not all. Now, some of those things may be out of my control, like waiting times, but doubtless some are down to me. I imagine many people probably just remember my bad jokes, and that's okay. But I remember Jerry, and I think I always will, and his family, and I've tried to do better ever since. I'm on call for the weekend again, and while it's daytime now, I was called in the middle of the night again, and once more it's those contemplative drives in the middle of the night and in the dark on a empty road with just the sound of the car to keep me company that makes me think of stuff like this. But, I like to keep you guys guessing. Will it be a deranged advert for fake cryptocurrency? Will it be some rant, or will it be one of these more introspective videos that I always think will be 5 minutes, but I've been talking for about half an hour, I think. The one thing it won't be is me selling you some kind of health product, and I'll be talking about health influencers hawking goods at Oxford University at the Preventing Overdiagnosis Conference in September. I'll be talking at New Scientist Live in October, and I'll be talking about other heart-related stuff at the Norwich Science Festival in February. So if you're in the UK, hopefully I'll see some of you there.